Good morning. Today, I'll provide an update on COVID-19 in Prince Edward Island and Canada and discuss a number of important items, including the COVID-19 situation in New Brunswick, masks, Remembrance Day gatherings, large outdoor gatherings happening in PEI, and workplace holiday parties. There are no new cases of COVID-19 to report today. We currently have 3 active cases in the province. These individuals are doing well and remain at home in self-isolation. Since the pandemic began, we've had a total of 63 cases of COVID-19 in Prince Edward Island. All our cases are travel-related outside of the Atlantic bubble. In Canada, there have been over 183,000 cases and over 9,600 deaths. Last week, there were almost 16,000 new cases of COVID-19 in Canada, a 21% increase from the previous week. There's also been an increase in the number of deaths, hospitalizations, and ICU admissions across the country. The largest number of outbreaks in Canada are reported in food, drink, retail settings at 36%, and long-term care and retirement homes, and then schools and childcare centers. In some provinces, the key factors in the spread of COVID-19 are household and community contacts and social and family gatherings. In order to contain the spread of COVID-19, jurisdictions are implementing significant public health restrictions, including closures and limitations on activities. During the summer, many of the new cases in the country were in the 20 to 39-year age group. However, this trend has shifted. Now we are seeing an increase in case numbers in the older age groups as well, where there is an increased risk of serious and fatal outcomes associated with COVID-19. The increasing incidence of COVID-19 in Canada is troubling. So overall, Canada is in an early part of a second wave of COVID-19. We are actively monitoring other jurisdictions, and we are trying to minimize any impact of a second wave in this province. New Brunswick is dealing with 2 outbreaks of COVID-19, one related to a special care home in Moncton and a regional outbreak in Campbellton region. New Brunswick has reported 76 cases since last Wednesday. Some individuals are in hospital, including intensive care, and there are cases involving students and/or staff at a number of schools. Both Moncton and Campbellton regions have moved into the orange phase of the New Brunswick alert system. In order to limit the spread of COVID-19, non-essential travel in and out of these 2 zones is strongly discouraged, and certain activities and services are restricted. Islanders, including students and staff in island schools who spent time in either of these regions since last week, are advised to follow the New Brunswick guidance, which includes wearing a mask if they're outside their household for the next 2 weeks if unable to maintain a 6-foot distance, and for students at school, following the school mask policy that's in place here in Prince Edward Island. Monitor themselves for symptoms of COVID-19 and visit a drop-in testing clinic if symptoms develop. Avoiding public places unless it's essential. Avoid large gatherings and minimize contact with individuals outside their close circle of contacts and household. The COVID-19 situation in New Brunswick is concerning on a number of fronts. It's very close to home. The spread has been rapid, and there are cases in schools and in a care facility. The situation serves as a reminder that it could happen just as easily in Prince Edward Island. Now is not the time to be complacent or reckless. It is easier to prevent and get ahead of an outbreak than to react to one, so we can all choose to take some very simple and basic steps to limit the spread of COVID-19 and protect ourselves, our families, our neighbors, and all islanders. I urge islanders to follow the basic and effective public health measures that we have been talking about for the past 7 months. Maintaining our physical distancing, washing your hands frequently, stay home and isolate if you have symptoms, wearing a non-medical mask or face covering when in indoor spaces, and keeping your circle of contacts small. For islanders and visitors who have traveled outside the Atlantic bubble, it is important that you follow the rules for self-isolation and testing. The guidelines are in place to protect islanders and travelers. We know some people do not want to self-isolate and try to find ways to avoid it or skip out early. Self-isolation and work isolation is so key to protecting your health and the health of fellow islanders. People are asking if masks will become mandatory in our province. We have continued to advise that islanders should wear a mask when in indoor spaces. Masks are just one level of protection against COVID-19. It is not the first line of defense. Wearing a mask does not replace other public health measures, including physical distancing, hand washing, keeping your circle of contacts small, and staying home when you're not feeling well. Our other public health measures and interventions are proving to be very effective in containing the spread of COVID-19. We have a very rigorous border measures in place, including pre-approval of travel. We have a high rate of testing, including rotational workers. We have Operation Isolation, where people get a daily call in isolation, and active enforcement when people are not following the rules. For example, Justice and Public Safety have completed 516 residence checks, issued 162 warnings, and issued 54 charges related to individuals who are not self-isolating. All of our 63 cases have been travel-related, and to date, we've not had any widespread community transmission of COVID-19. So at this point, based on our public health measures and our epidemiology, masks continue to be strongly recommended in closed indoor spaces for now. Remembrance Day is an important event in communities across the province, as islanders take time to honor our veterans and the countless sacrifices they made for our freedom. This year is a special one, marking the 75th anniversary of the end of the Second World War. Like many aspects of our daily lives, Remembrance Day 2020 will be different. We appreciate the leadership of the Royal Canadian Legion in taking the unprecedented step of discouraging mass spectators from attending the Remembrance Day services in Ottawa this year. They recognize the importance of a live ceremony with a modified format to support the important tradition of honoring our veterans. We will not allow COVID-19 to interfere with how we remember our veterans. We will remember them differently this year. Ceremonies in PEI this year will be smaller and respect the need for 2 meters of physical distancing. All Remembrance Day ceremonies must adhere to the public health guidance. The safety of attendees is important. If over 50 people are attending, an operational plan must be approved by our office. Staff in our office are available to answer questions from communities and groups planning Remembrance Day services to ensure they are hosted in a safe manner. Our government partners will assist where needed. And given that November 11th ceremonies will be different, I encourage Islanders to show their respect for veterans by purchasing a poppy when they go on sale in late October. Our office has received reports of some very large, uncontrolled outdoor field and pit parties held in various communities across the province. In some cases, there have been as many as 400 young people in attendance, with some youth being as young as 15. Also, we have been informed of large house parties with upwards of 100 young people in attendance. In addition to presenting the risk or a risk to the health of attendees, their families, and close contacts, in the absence of an approved operational plan, these parties are against the law. I encourage young people to think twice about organizing or attending large parties. When I ask Islanders to keep their circle of contacts small, this applies to Islanders of all ages. Young people are not immune to the virus, and some have become critically ill themselves with COVID-19. Last week, we spoke about the possibility that holiday and Christmas travel may be different this year. And although it's 2 months away, it's reasonable to assume that self-isolation will probably be required for family members who travel to PEI from outside the Atlantic bubble. The discussion about holiday travel has also raised questions about Christmas and holiday parties. It's a long-standing tradition for many employers to host parties for staff and sometimes clients. As I mentioned earlier, other jurisdictions are learning that personal and workplace gatherings are a key source of transmission of COVID-19. So while holidays are a time for sharing and generosity, I encourage employers to consider alternative ways to acknowledge staff and/or clients this holiday season. In keeping with the public health advice to keep your circle of contacts small and maintain physical distancing, Christmas and holidays 2020 is a year to be creative and find new ways to recognize the hard work and support of staff and clients and perhaps forgo the traditional holiday party. For businesses choosing to host a holiday gathering, an operational plan must be developed, and that includes physical distancing. If there are more than 50 people attending, the operational plan must be submitted and approved by the office. And still on the holiday theme, I encourage all islanders to consider supporting our local businesses and entrepreneurs this holiday season. There are two other important items I'd like to mention briefly. And the first is please download the National COVID Notification app. This app is free of charge and will notify you in the event you were exposed to someone who tested positive for COVID-19. The app is designed to help break the transmission cycle of COVID-19. It does not replace traditional contact tracing. The app can be downloaded from the App Store of Google Play. Secondly, a reminder to anyone who goes to a testing clinic to please bring along your health card. Having your health number expedites the testing process. In closing, as islanders are understandably concerned about the possibility of an outbreak in our own province, now is the time for us to recommit and be resolute in our efforts against COVID-19. We can lower our personal risk by reducing in-person contacts and the duration of such contacts. Each of us has the ability to try to keep one another safe and protect ourselves, our families, and our communities against this virus. During the weekend, I had a chance to sit with family and extended family, and each person had a chance to say what they were most thankful for over the last year, from youngest to oldest. And a common theme was that they are truly thankful to live in Prince Edward Island. They feel safe, they can go to school, they can play sports and music, and they can be together. And I thought, how true. I'm also thankful that we are together in PI going through this with each other. So please be patient, please be kind. Thank you. I'll turn it over to you, Mary.
Thanks, Dr. Morrison. The Health System Joint Response Team continues to be in an active monitoring and planning level. The Chief Public Health Office continues to ensure we're aware of the national and local, including New Brunswick situations, and any impact it may have on Islanders or our services. As Dr. Morrison has directed, Islanders returning from travel from the Moncton or Campbellton regions of New Brunswick have clear public health guidance to follow. This includes those who needed to travel for medical appointments. If you do have an appointment, in particular in the Moncton area, it would be advisable to call ahead to your service provider to confirm your appointment. This week, we have adopted a newly updated visitation protocol across Health PEI. Our visitation protocols have regularly been reviewed and adjusted as the local COVID-19 situation changes. For PEI, we continue to be fortunate in that our updated protocol further allows visitation for people across our health system, including those in long-term care. We are still asking that people be patient and help our facilities follow the physical distancing measures and any operational plans they may have in place. Our testing sites continue to be busy, and we provided more than 590 tests over the long weekend. Most of this testing has been at our drop-in sites. And people can refer to the government COVID website for updated times and locations, but they are available 7 days a week. People with symptoms can get tested on the same day and view their result, if negative, online within 72 hours. We also continue monitoring of supplies and equipment, and I'm happy to update Islanders that Health PEI has received all of our ventilators that we had ordered in the spring. We now have 41 ventilators available to us in place, which is many times more than what is usually needed. While ventilators are important to have, our focus is on containing this virus and the strong public health precautions, including robust testing, contact tracing, and of course, our hand washing, mask wearing, and physical distancing. I also want to update and share that we've been able to reinstate some of our adult day programming services for seniors in our province. In partnership with long-term care, Brecken House has reopened, and this is located within the Prince Edward home. This service has started by providing programming 5 days a week, and we'll be monitoring how this proceeds, and planning is being completed to support the reopening of our other day programming sites in the near future. We know how important these services are for Island seniors and their families, so thank you to the staff and the partnership with long-term care in getting these reinstated. I want to also thank our staff and physicians once again for their continued dedication and hard work throughout this pandemic. And thank you to Islanders who continue to follow the public health guidelines, wearing masks, keeping your social circle small. Please remember to also take Dr. Morrison's advice to be kind and respectful of one another and of our Health PEI staff when you attend services. We've all been under a lot of stress and have experienced difficulties in dealing with this pandemic. So let's continue to be caring in how we address and interact with one another. Thank you.
Great. Thank you, Marion. And I'll open it up for questions.
Brian Higgins, CBC.
Yeah, good morning, Dr. Morrison. Worldwide health authorities are talking about sticking to using targeted interventions and rather than blanket lockdowns, but notwithstanding that, just wondering what would it take locally for PEI to make the decision to close the border to New Brunswick, given the situation there?
Hi, Brian. So I think we have talked about it before in terms of there's no one single measure, no one single case count that will influence or make a decision about moving from our phase now into more restricted phase. But it will be a certainly discussion amongst our colleagues in Nova Scotia, New Brunswick, Newfoundland, and of course the premiers would be talking about it as well. But looking at our health system capacity, our public health system capacity, our cases, our outbreaks, and putting all that together before we would be making a recommendation to change that border.
Is closing the border something that's on the table?
I mean, I'm not talking about closing a border today, and really we want to maintain that Atlantic bubble as much as possible. We know that the first couple months of this pandemic, the movement between our provinces was much more restrictive. I am hopeful we don't have to go back to that those early weeks and months, but we're trying to make decisions all the way along, Brian, that will be what we're doing will protect the health of Islanders. So we know that the risk of importation of all our cases has been related to travel outside the Atlantic bubble, and so we will continue to monitor what's going on, not just in Atlantic Canada, but around the country as well.
Thank you.
Natasha Pace, CTV.
Hi. Dr. Morrison, you mentioned that some parts of the country are already starting to see the early signs of a second wave. I'm wondering, what is the situation in PEI right now? Are you also starting to see the second wave happen right now?
No, in Prince Edward Island, and we were very fortunate. We've not had, through the whole pandemic, we've not had any hospitalizations. We've not had any deaths. We have a total of 3 active cases that are all related to travel and are self-isolating. So we have not experienced the beginning of any second wave at this point. And I'm hopeful that we will continue to do everything we can to mitigate that potential second wave from happening here.
Thank you. You mentioned Remembrance Day, and I apologize, you may have already had this question, but what about Halloween? What is the rule for folks in PEI about Halloween this year?
So in terms of Halloween, we're going from we have one sort of holiday and one event after the other. But Halloween, we did put out some guidance that's available on the website regarding some of our recommendations around Halloween. And I think they're fairly much in keeping with some of the guidance that's being given across the country. And so that if, I won't go through all of them right here, but they are available on the website. We did speak about it, I think, a week or so ago here.
François Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Pourriez-vous m'expliquer en français la raison pour laquelle vous décidez de ne pas imposer le port du masque obligatoire à ce moment-ci?
OK. Bonjour. Et puis, c'est vraiment, je vais regarder pour mes notes en anglais pour voir si je vais les traduire un peu. Les masques sont seulement un niveau de protection. C'est pas comme la première ligne de défense. Et puis, porter les masques ne remplace pas les autres mesures de santé publique. C'est alors la distance, garder la distance physique, laver les mains, garder le cercle de personnes qui sont des contacts assez petits, rester chez vous si vous êtes malade. C'est les choses comme ça qui sont très important. Et puis, alors, c'est pour cette raison, mais aussi qu'on a des autres mesures en place ici à l'île du Prince-Édouard qui font des grands efforts de limiter le COVID-19. On a des mesures au point d'entrée. On fait beaucoup de tests aux gens, même les gens qui travaillent hors du province. Nos cas ici à l'île du Prince-Édouard, les 63 cas sont liés au voyage hors de la boule atlantique. Alors, on veut que les insulaires portent les masques si vous êtes en dedans et vous ne pouvez pas garder la distance physique. Et on va continuer de regarder l'épidémiologie et puis les mesures. Et si on doit changer, on va le faire. Mais à ce moment, on veut que les insulaires portent les masques à l'intérieur. Mais c'est... Et puis, si on doit changer, on va le faire.
Et pour l'avenir de la bulle atlantique, pour l'instant, les déplacements continuent comme c'était le cas depuis le début du mois de juillet. Qu'est-ce que ça prendrait? Quel niveau de gravité de la situation au Nouveau-Brunswick ça prendrait pour apporter des changements à la bulle atlantique telle qu'on la connaît présentement?
Et puis, j'ai essayé de répondre à ça en anglais aussi. C'est pas un seul facteur. Ça va être on regarde les nombres de cas, la capacité de la capacité de la système santé publique. On va avoir les discussions avec mes collègues à Nouvelle-Écosse et Nouveau-Brunswick à Terre-Neuve. Et puis, je sais que les mêmes sortes de discussions vont aussi avoir entre les premiers ministres. Alors, c'est un nombre de facteurs et j'espère qu'on peut garder la boule atlantique. Et à ce moment, c'est le cas.
Merci beaucoup.
Louise Martin, CBC.
Oh, hi there, Dr. Morrison. Just if you don't mind repeating anything that was new in what you said in French, in English, if at all possible.
Okay. The last part of the question was about what would make us change and not or like move away from the Atlantic bubble. So it was really repeating the question that I just answered in English. And the other one was also repeating the question about masks and what I'd said about masks in French. So I just was translating some of what I had already said.
So, Dr. Morrison, I'm just wondering, given that the public health measures in place in the Moncton area and Campbellton, and non-essential travel is being discouraged right now, what kind of enhanced screening measures are happening at the border and PEI for those coming in from the Moncton area or Campbellton? And would you consider, stronger measures for those particular areas, like 2 weeks of self-isolation?
So starting at the end of last week, we actually had additional material that was sent to both Wood Islands and to Borden for the bridge in terms of messaging for our screeners. And then we changed it to even enhance it on Sunday morning. Even stronger messaging went up on Sunday morning. And so we know that we may need to change it again. And so and also, if we need to change the questions that we're asking, we will. So we're giving enhanced information at our points of entry in terms of the ferry and the bridge. And then we're looking at, depending on the situation in New Brunswick, if that changes there, then we will adjust here. And at this point in time, the Moncton area outbreak, I think the risk is low for people who have been traveling there. But having said that, out of an abundance of caution, we are following the public health advice that has been given by Dr. Russell over there, and advising sort of enhanced attention and being vigilant about avoiding large gatherings and monitoring for symptoms and wearing a mask if you're outside your household. And so I think that's important. So we'll just continue to adjust. We've been making those sort of proactive information out to, for instance, long-term care facilities for their staff over the weekend, increased information at the bridge and the ferry, and we'll adjust if we need to in the days ahead.
And then I know that you had sent a letter to the public schools branch as well for guidance for staff and I would assume students as well. And I'm just wondering, out of this abundance of caution, and I know how fearful you have been and continue to be about community spread on PEI, and I know that the enhanced measures, including, like you said, masking and avoid public spaces or places unless it's essential. How do you reconcile allowing teachers to go back in, or students who have maybe traveled to Moncton or Campbellton on the Thanksgiving weekend? And, was there any consideration to not allow them to work until maybe they had been tested?
We were basing our information, and I've been in touch with Dr. Russell and Dr. Strang and Dr. Fitzgerald all over the weekend multiple times. And so we are giving very similar advice here in Prince Edward Island as they are in, for instance, Nova Scotia. And if I felt that we needed to keep everyone home who'd been over in New Brunswick, that would be a very different recommendation, and we would be doing that. So it is students and staff and Islanders are getting the same advice that they are getting in New Brunswick, and it is really out of an abundance of caution and making sure that employers, both in the public schools branch and Commission Scolaire Française and then Health PI and private long-term care, are just making sure their staff are aware. We also know about how virus is usually transmitted in the school setting from an adult to a child. So that's why very important that the mask policy that is in place in the schools is followed. And they have a very good mask policy, and masking on buses, for instance, those are important measures. So it is something that we have been having conversations about and certainly want to be consistent with our neighboring provinces, but following what is going on in New Brunswick.
Appreciate your time. Thank you so much.
Rachel Collier, The Graphic.
Good morning. My first question is for Dr. Morrison, and it's a bit of a throwback. I'm wondering if you were on call to respond to Premier League soccer matches this summer, and if you were, maybe you could speak a bit more about your role and involvement there.
Was I on call? So I share on-call responsibilities as the public health officer a lot. So I'm on call 1 and 2, but I did not work at any of the CPL games, if that's what the question is. So I'm not quite sure, is that what you mean?
Yeah, I guess I'm just wondering if you had any extra responsibilities involving the Premier League this summer, or if it was just your regular routine.
Well, I think so. We're certainly our office worked with tourism department as well as the CPL in terms of their operational plan, and I think we talked about that quite a bit here. I spoke over the summer or later summer months about some of the processes that were in place with the CPL, and the testing that was done in combination with Health PEI, laboratory with for the CPL players, and that and they paid for that as well. So I'm not sure. Again, that's but I'm not sure what other involvement you were looking for.
Yeah, I guess I was just wondering if you would have been on call to respond to medical emergencies in a way that would have been an additional responsibility for you, or if it was just your routine on call responsibilities.
No, so they have for every CPL game that was held here this summer, they had a physician on site. That was part of their protocol, and so a physician was available at the game, but that was not me.
Okay, that's kind of what I was trying to understand there. And then I guess I have another question for Marion Dowling, and I guess that is, do staff shortages within the healthcare system, do they kind of compound our need to prevent outbreaks and avoid hospitalizations at this point?
Hi, Rachel. I guess I would say that any staff shortages we've had over the past number of months certainly have been highlighted through our pulling on staff to provide additional services around our COVID response or redeploying staff from service areas. And so now that we're opening things up, we certainly feel the pressure and continue to work with the department and the Recruitment and Retention Secretary to fill any of those vacancies we may have across the system.
Okay, thanks so much.
Stu Neepy, The Guardian.
Afternoon to you both. I guess first question to Dr. Morrison. Just reading the letter to the public schools branch and the Commission Scolaire, it sort of reads that people who traveled from staff who traveled in Moncton or Campbellton should wear a mask at all times while at work and in public settings. Now that reads a little bit more than a strong recommendation. So should staff at the PSB or Commission Scolaire consider this to be almost be like a mandatory mask recommendation while they're at work?
For the 2-week period that they're back, that is, I mean, we have not made it, to make something mandatory, it has to go in an order, but it is a strong recommendation like our others, and that is also following the public health guidance out of New Brunswick.
Okay, so I'll read that as a little bit above a kind of a recommendation, I guess. All right. So second question, I suppose, would be for Ms. Dowling. We'd heard from Heather Kaiser and Verna Ryan during a standing committee, I believe a couple of weeks ago, that the psychiatric unit, Unit 9 at QEH, would be reopened sometime soon. So I'm wondering if you can provide an update on that.
Hi, Stu. I don't have a specific date to update you with today. I know they have been working alongside both the Queen Elizabeth Hospital and Prince County Hospital, as well as the team within mental health and addictions at the Provincial Addictions Treatment Facility and Hillsborough Hospital to reinstate Unit 9 as an acute psychiatric unit at QEH. And as far as I understand, they are working toward the goal of doing that by the end of this month in October. So I don't have anything further on you today, but certainly I can get one of those leads for mental health and addictions to reach out to you if you are looking for further detail.
Okay, yeah, sure, that would be good. Just looking for, I guess, if at that time when it's sort of reopened, what kind of, like whether the programming will be completely reinstated and that sort of thing.
Sure, and I can certainly bring an update here whenever those plans are finalized and ready to go.
Okay, thank you very much.
Laurent Rigaud, La Voix acadienne.
Good afternoon to you both. Dr. Morrison, j'ai une question en français. Vous l'avez évoqué en anglais tout à l'heure. Vous avez dit que vous avez rappelé aux jeunes personnes que quand elles organisent des grandes fêtes, c'était contre la loi, mais aussi dangereux. Est-ce que vous pouvez nous en dire un peu plus sur les risques au Canada? Est-ce qu'il y a des cas graves parmi les jeunes générations aujourd'hui?
Bonjour. Oui, on mentionne que je sais que la majorité des décès, les cas à l'hôpital sont les personnes les plus âgées, mais il y en a les jeunes aussi, moins de 20 ans, entre 20 et 39 ans, qui doivent aller à l'hôpital avec COVID-19 et puis ils sont très malades. Alors, ils ont des risques eux-mêmes d'avoir COVID-19 et aussi le danger de transmettre le COVID-19 aux personnes dans la communauté ou dans les résidences à long terme. Alors, on voit ces sortes d'activités et puis on a eu quelques-unes dans la semaine passée. Alors, je pense que c'était important de mentionner que c'est pas seulement les plus âgés qui deviennent malades. J'ai pas en avant de moi le numéro exact des cas qui sont moins de 20 ans, mais je peux en chercher puis envoyer si vous voulez.
Merci beaucoup. Et j'ai une autre question. On voit dans certains articles au Canada ou ailleurs dans le monde, des gens qui racontent que même après avoir eu la COVID sans aller à l'hôpital, ils en gardent des problèmes pendant des semaines avec des difficultés à respirer ou des difficultés pour faire du sport. Est-ce que parmi les 60 cas qui sont guéris aujourd'hui à l'île du Prince-Édouard, est-ce qu'il y a un suivi? Est-ce qu'il y en a qui ont des problèmes qui restent après la maladie?
C'est une très bonne question. Et je sais qu'on est en train de comprendre mieux et mieux les impacts et les effets du COVID-19, même qui sont un peu plus longs dans les derniers mois. Et on a eu, je pense que c'est deux personnes des 63 qui indiquent qu'ils ont eu, ils se sentaient pas meilleurs juste après 14 jours. Ça a duré un peu plus long et puis ils sont pas bien, ils sont plus fatigués mais on est en train d'en communiquer avec eux, mais ils sont pas à l'hôpital.
Merci beaucoup.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Dr Morrison, j'aimerais savoir si concrètement, toutes les personnes, vous avez parlé notamment d'élèves ou de personnes qui sont allées au Nouveau-Brunswick pour Thanksgiving, voir de la famille, et qui sont allées dans les deux régions affectées que sont Moncton et Campbellton. Est-ce que vous demandez à ces personnes-là qui rentrent à l'île du Prince-Édouard de s'isoler, de passer un test de la COVID, ou alors ils peuvent vaguer à leurs obligations et juste porter un masque comme à l'habitude?
Oui, à ce moment, on les dit de faire la même sorte de choses que est suggéré au Nouveau-Brunswick, qu'ils portent un masque pour 2 semaines s'ils sont hors de la famille, puis c'est regarde pour les symptômes et puis d'être testé, mais de vraiment prendre soin de ne pas aller quelque part avec beaucoup de personnes. Mais alors, il peut continuer à ce moment leur activité avec un peu plus de précaution. Alors, et puis ça, c'est qu'est-ce que ils ont dit à Nouveau-Brunswick, et puis on garde le même message ici à l'île du Prince-Édouard.
Parfait. Deuxième question pour vous, Dr Morrison. On l'a vu la semaine dernière, je vais vous parler un petit peu de sport. On l'a vu la semaine dernière, un match de la LHJMQ en hockey a été annulé entre Moncton et Saint-Jean à cause de ce qui se passe au Nouveau-Brunswick. Est-ce que vous, concrètement, aujourd'hui, vous êtes inquiète de voir, par exemple, les Highlanders de Charlottetown jouer contre Moncton, se rendre au Nouveau-Brunswick, ou que l'équipe de Moncton se rendre ici à l'île du Prince-Édouard? Est-ce que vous voudriez, par exemple, demander l'annulation, le report de ce genre de rencontre pour le moment?
Alors, on est en train de regarder l'horaire des matchs entre les Islanders et les autres équipes ici au Maritime. Et puis, ils n'ont pas un match pendant le week-end et dans les prochains jours. Alors, on n'a pas fait une décision. À ce moment, on va regarder qu'est-ce qui se passe dans les prochains jours. Mais c'était quelque chose on a regardé samedi pour voir si on avait besoin de faire des changements.
Merci beaucoup.
Bateman, Times and Transcript.
Oh, hi there, Doctor. You've got a lot of questions already about the border. I have just a bit of a variation. What prevents you from screening out the people traveling to or from the specific zones in Moncton or wherever would have an outbreak? It seems to me like it would be a pretty easy question to ask at the border, along with the other screening questions. Would that be like an interim measure that could keep the larger Atlantic bubble intact, like you spoke about previously?
Yes. So, I mean, I think that's what we are getting prepared to do, particularly if the area, particularly for the area of Campbellton in New Brunswick. So we're just waiting word and an update today from New Brunswick. I believe that the outbreak in the Moncton area is I think pretty well controlled at this point in time. So we're waiting word on an update about the situation. We are in a really good position here in Prince Edward Island with very only so many ways to get into Prince Edward Island, and a self-declaration form that needs to be signed and filled out, and enforcement and screeners at our points of entry, that we can make those changes quickly. And that's why the extra information has been already available at the bridge for anyone traveling back from those locations. And then, and if we need to then change measures for certain regions, we will do so. And again, it will be based on what we learn from New Brunswick.
Okay, so yeah, assuming there's no unfortunate surprises from the Moncton region, it would be only the Campbellton region where things are still, the outbreak's still ongoing, that could be screened out of entry.
Correct.
Great, thank you.
Great, thanks. I know there were a few questions in French there, and one was about the fact that there are young people who still are getting sick and are ending up in hospital with COVID-19 across this country. And another question was around some people, there are reports across the country and in other parts of the world that people with COVID-19 are getting symptoms, are having symptoms that seem to last longer than they would expect. And so certainly the whole country learning about the longer term impacts for some people of having COVID-19. I was also asked a question about the Islanders, the Quebec Major Junior Hockey League. There was a game, Quebec Major Junior Hockey game that was canceled on the weekend, I believe, in New Brunswick between teams, but there were no Islanders games over the weekend that involved the Quebec Major Hockey League, from my understanding. So there was no decision in terms of canceling any of those games. So I think that's what I remember. So I think that's it. Thank you very much.